Hey, Press On, here's an update. Just a big picture of what's been happening over the past year or so. Been dealing with a lot of right knee pain, particularly on the lateral side. Ended up getting an MRI about 4 months ago and revealed that I had a torn meniscus, among some other small things as well, some arthritis. So I continue to do what I've been doing for the past year, a lot of ATG exercises, basic stuff like backwards walking, Poliquin step up, just their basic ATG zero protocol that Ben Patrick, the Knee Over Toes guys, recommended. I saw success for a few months in there, then I kept pushing it hard again, kept regressing back after I felt some pain, and things just kept getting worse. And even the backwards walking, all that stuff started to hurt. So there just really wasn't a way forward. I tried tendinopathy stuff. I tried meniscus repair protocol of ATG. I ended up going to a chiropractor, went to a physical therapist, ended up meeting, as you guys know, with an orthopedic surgeon, and went down that route. Most of my pain was on the lateral or outside, and the meniscus tear is on the medial or the inside of the knee. So it just seemed real weird. It was discovered in the MRI that I have a fibella, which is that extra bone that I made some videos about earlier. And I felt like that might have been the source of pain, but then there was catching in the back of the knee, and that's, of course, very close to what they have meniscus tears issues with. So, been doing some isometric holds I did some videos on and saw the swelling go down, but anytime I had any sort of a knee bend, that's when the inflammation and the pain would come back. If I stood on my knee for more than 15 minutes to a half hour, I'd have pretty decent pain on there. So I decided to go through and have surgery on that. The frustrating thing with all this was I believed that the backwards walking and the step ups and different things like that would help, but every time I did those things, something would bother it in that knee joint. Backwards walking ended up bothering that bicep femoral hamstring tendon. When I did the ATG split squat, there was a lot of excruciating pain behind the knee. Everything was behind the knee. And from my knee to my heel on that fibia bone, I had a lot of pain as well. I'm not sure exactly still what was going on there, if everything stems from that meniscus pain or if there was something different. That's one of the reasons why we decided that we knew that there was a meniscus tear, and that was the thing that we had to go after. This isn't a new thing that I've been dealing with. I know I've had probably a meniscus tear for some years, back in around 2017. It's 2024 right now. So back then I had my knee lock up, had to have the chiropractor put my knee back in. And I've had some small pain there, but nothing too excruciating. It's just been ever since I decided to start upping my training and competing again rather than just daily fitness and preparing for the tactical games that things really got exposed. And I ended up trying these different things, gave myself some sciatica pain, which I had to deal with that. Still dealing with small amounts of that, but a lot of the Jefferson curls and seated good mornings helped with that as well. So thank goodness that was gone. So now I just had to focus on the knee, and I could sleep more. For a while there, 3 months ago, I had issues sleeping because of that pain in the knee. So ever since surgery, the past couple nights, I've been sleeping very good compared to what I was before. So the meniscus repair so far has taken care of a lot of that pain. So I'm hoping that this meniscus surgery was the answer, and that was the cause of all that lateral pain. It was just a ghost type pain on the outside there. We'll see. Today we're talking day 4 of surgery. I'm starting to see a little better range of motion and stuff. Still have that tightness behind the knee, so I'm a little nervous there, but we just have to be patient and go through it. Still have a lot of swelling, so that's going to be the issue. I had a lot of swelling before, and that was probably an issue of that lack of range of motion as well. So I'm going to stick to the protocol, and then probably in about 7 to 10 days after surgery, I'll start some light backwards walking and get some blood flow into there, and then I'm going to do some ATG strengthening to hopefully stop all this knee pain. I'm going to have to make a decision about Staccato Ranch, which is about 12 weeks out, to see whether or not I compete in there. Number one priority is a healthy knee, then competing. I'm not going to compromise knee health over that. So we'll just see how things are going. I'll keep you guys updated. Talk to you guys later.